June 2nd. A lot of tests, a lot of anxiety. The doctor recommended the drug Pergonal. Perhaps I shouldn't, but I'm thinking, this is it. Mom agrees. I called her today. The two of us are excited, but I don't let Bob know. He's not the optimist I am.
In approximately 40% of cases, the woman is the primary source of the infertility. In another 40%, the man is the primary source. In the remaining 20% of cases, either both partners are equally implicated or the cause for the fertility remains unknown.
June 7th. I've been injecting Pergonal every day. Surprises me that I can put the needle into myself. What's proving more difficult is having to stop by the hospital every day on the way to work to get my blood tested, rushing to get there, waiting to be seen, all the time anxious about what's going on at work that I should be attending to. I hope this works. It just has to.
The most common fertility problem among men is having either a low sperm count or poor sperm motility. Low sperm count refers to the condition in which the male produces an insufficient number of sperm that are alive, well-formed, and with enough motility to reach the egg in the female's fallopian tube. Sperm motility refers to the ability of the sperm to move effectively so that they may travel the necessary distance to reach an ovum.
June 15th. The Pergonal worked. The sonogram showed that I have 9 egg follicles ready. Think of it, 9 opportunities. 1, please, no more than 2, of them must be a baby. Called Mom. She'll come, of course, whenever we need her. AI, artificial insemination, has been scheduled. Bob is unusually quiet. Changes the subject a lot. His mom called last night, and he went into the other room to talk to her. I'm sure it was all about this, but I didn't ask.
Attributed to a number of causes, including congenital abnormalities, about 5% of young adult American males are infertile because of an insufficient sperm count. The vast majority of men, however, have more than twice the required number of normal motile sperm. And while it is true that the number, shape, and motility of sperm are adversely affected as men age, the decline is very gradual. Because sperm are continuously manufactured in the testes, any condition that impairs the normal functioning of the body can also impact fertility. A high fever, medical therapy that involves radiation treatment, or high doses of prescription drugs can affect the number, shape, and movement of the sperm being produced, and its impact can last over a period of several months. Exposure to environmental toxins, unusually high levels of stress, or an episode of drug or alcohol abuse can do the same. These conditions are not the direct result of the aging process. Aging is a factor, however, because as men grow older, the incidence of illness increases, and with it comes the need for medication and treatment, both of which may compromise fertility.
June 16th. We made it through the artificial insemination. It was very strange. Bob is really feeling the pressure. Deciding to have a baby was supposed to bring us closer. It's making things much more difficult for us. Still thinking, this is it. I must believe this will work. Doctor says it might take 3 or more times. Expensive for us. Mom says she and Dad will help.
Difficulty with ovulation is a common fertility problem associated with women. An estimated 2% of women do not ovulate naturally, whatever their age. Women who start out ovulating regularly become increasingly more prone to irregularity as they approach middle adulthood. Since women are born with all the ova that they will ever have, the supply becomes less fertile and less healthy with each passing year. Another common fertility problem for women is having blocked fallopian tubes. This condition is often caused by having untreated pelvic infections called pelvic inflammatory disease, or PID. Just one episode of an untreated PID brings a 1 in 5 chance that the woman will become sterile. The chances of contracting PID increases in concert with the number of sexual partners a woman has.
June 18th. Trouble. Yesterday I doubled over at work. Terrible sharp pains in my abdomen. Went to the doctor. My ovaries had swollen from the Pergonal. The nurse says it still may be okay, meaning we still may conceive. I'm in bed now for 10 days. Again, waiting. Today, I'm not so sure that this is it for us. Calling Mom. Maybe she'll come.
Endometriosis can also cause infertility. In this condition, fragments of the uterine lining travel to and begin to grow upon the surface of the ovaries or fallopian tubes. Both damage fertility opportunities, either by preventing ovulation or blocking fertilization. Endometriosis is most common between the ages of 25 and 35. About 1/3 of women who experience endometriosis become infertile. In terms of physical development, the young adult is at his or her prime. His speed, coordination, strength, and endurance are greater than they have ever been, and greater than they will ever be again. For women, the capacity to both become pregnant and have a healthy baby is greater during this time than at any other. The typical young adult man or woman enjoys vibrant health, vast amounts of energy, and only a glimpse at the process of aging that has quietly begun.